Ever feel like you're just memorizing a ton of drug names, but you're still totally lost on how they actually work? Well, you are in exactly the right place. Because when you finally get the why behind the respiratory system, all those medications just click. And trust me, the PTCB exam gets a whole lot easier.
So, let's do this. We're going to break down the entire respiratory system, fast, simple, and totally focused on what you absolutely need to know to walk into that exam feeling confident.
Okay, everything, and I mean everything, starts right here. At its very core, respiration is just the body's super smart system for a simple trade. It brings in the good stuff, oxygen, and it gets rid of the waste, carbon dioxide. And that's our goal for this entire PTCB Prep guide, making these big ideas simple so you can learn faster, remember more, and ace your exam.
So here's our game plan. First, we'll get the big picture. Then, we'll literally follow a single breath from start to finish. We'll zoom in on where the real magic happens, connect it all to the drugs you gotta know, and then we'll finish with a rapid-fire review to make it all stick.
All right, first up, the big picture. Here's the thing, you really can't talk about the lungs without talking about the heart. They are a total package deal, an inseparable team. That's why you'll hear doctors talk about the cardiopulmonary system.
And this right here shows you why they're a team. Think of it like this. The lungs are the loading dock. They load up fresh oxygen onto all the little delivery trucks, which is your bloodstream. Then, those same trucks go out, drop off the oxygen to your body's cells, and pick up the trash, carbon dioxide, and haul it right back to the lungs to be thrown out. One system just can't work without the other. It's a perfect partnership.
So these are the main players we're going to be talking about today. You've got the entryway, the nose, pharynx, and larynx. You've got the main highway, the trachea. Then you have the branching roads inside the lungs, the bronchi, and powering the whole operation is the diaphragm. Don't forget that one. It's the powerhouse muscle that makes every single breath happen.
Okay, now that we've met the team, let's actually follow a single breath of air on its incredible journey from the outside world deep into your body.
This is the full map of the journey. Air comes in the nose, goes down the pharynx, which is your throat, passes the larynx, your voice box, and enters the main pipeline, the trachea. From there, it splits into the two bronchi, which then branch out again and again into tiny little bronchioles, until it finally reaches the end of the line, the alveoli.
All right, quick pop quiz to see if you're paying attention. We can all breathe through our mouths, right? So why is breathing through your nose so much better? What are the three main benefits? Think about it for a second.
And time's up. If you said it warms, moistens, and filters the air, you are absolutely right. Your nose is basically a built-in high-tech air purifier. It traps all the dust and germs with mucus and these tiny little hairs called cilia, all while making sure the air is at the perfect temperature and humidity before it hits your sensitive lungs. Pretty cool, huh?
Okay, this is a big one for the PTCB. You've got to know the difference here. The trachea, your windpipe, is kind of the dividing line. Everything above it is the upper respiratory system. Everything below it is the lower respiratory system. This distinction is super important for understanding different illnesses, like why a common cold is an upper respiratory infection.
You know, the best way to picture the lower system is to think of an upside-down tree. Seriously, the trachea is the thick trunk. It splits into two big branches, the bronchi, one for each lung. And then those branches just keep splitting into smaller and smaller and smaller twigs called bronchioles. It creates this huge network for air to travel through.
Okay, we've followed the air all the way down the tree. And now, we've arrived at the most important place in the entire system. This is where the magic happens, and it's a huge deal for the PTCB. The term you need to burn into your brain is alveoli. Say it out loud with me. Alveoli. These are the millions of teeny tiny little balloon-like sacs at the very end of the line. This is it. This is the spot where oxygen actually crosses over into your blood and where carbon dioxide jumps out of your blood to be breathed out. If you get a question on the exam asking where gas exchange happens, the answer is always the alveoli. Now here's a detail that sometimes trips people up. Respiration actually happens in two stages. External respiration is the gas swap in your lungs between the alveoli and the blood. But internal respiration, well, that happens all over your body. It's when your blood finally delivers that fresh oxygen to your individual cells and picks up their CO2 waste in return.
Okay, you made it through the anatomy. We built the foundation. Now for the payoff. Let's connect all this to the pharmacy. And I promise, this is where memorizing all those drug names is finally going to make sense.
You know, when you boil it all down, it's actually pretty simple.
Most of the common respiratory meds do one of two things. Job number one, open up the airways, those bronchi and bronchioles we just talked about. Job number two, reduce inflammation in those exact same airways. That's pretty much it. They either open things up or they calm things down.
And this slide is pure gold for the PTCB. It's all about the suffixes, the endings of the generic drug names. Look, if a drug ends in -erol, like albuterol, it's a bronchodilator. It opens the airways. If it ends in -sone or -lone, like fluticasone, it's a corticosteroid. It reduces inflammation. Let's try it. Say this out loud right now. -erol equals bronchodilator. Seriously, say it. It helps.
Now, this is so important, not just for the exam, but for patient safety. Rescue inhalers, those are your aerols, they work fast to open the airways during an asthma attack. They are for a rescue. Maintenance inhalers, often your sones, are used every single day to keep inflammation down and prevent attacks from even happening.
All right, let's bring it home with a high-yield review. These are the must-know, non-negotiable facts you need to have locked in before you walk out of here today. These are your big red flag safety alerts. First, always tell patients to rinse their mouth with water after using a steroid inhaler. That's your Sone and Lone drugs. Why? It prevents a nasty fungal infection called oral thrush. And drill this into your head. Rescue inhalers are for attacks. Maintenance inhalers are for prevention. Never ever get those two mixed up.
Here's a fun little trivia fact that could totally pop up as an exam question. Your right lung has 3 sections, or lobes, but your left lung only has 2. Any idea why? It's to make a little extra space for your heart. A simple, memorable fact that's easy for them to test.
You guys did a fantastic job today. See how it works? When you understand the why behind how we breathe, the medications, and how they work just makes so much more sense. That right there, that's what real mastery feels like. So for your next steps, go back and review those key terms, practice explaining the difference between inhalers, and just keep repeating those drug suffixes every day. So I'm going to leave you with this final question. Now that you truly know the why, what's that single most important piece of advice you can give a patient who's starting a steroid inhaler, like fluticasone? Think about it. And hey, if this helped things click for you, give it a like, subscribe, and maybe share it with another pharmacy student who could use it. Keep going, you've totally got this.